Well, medical devices have followed the same trend as electronics in general and equipment and technology in general. Once upon a time, we had a very simple printer that had limited capability, and now our printers can connect to our smartphones and to the internet from our homes. So there's been an enhancement of technology throughout our lives, and the same thing has happened somewhat more slowly and more incrementally in medicine, but the same things are happening. We've gone from completely very basic, simple acoustic stethoscopes to electronic stethoscopes that can store sound. And if you hear something interesting, you can share that sound with someone else to help analyze it, for example. We've gone from manual blood pressure monitors, which you may remember someone squeezing the bulb and checking your blood pressure. Well, imagine doing that every 3 minutes all day long in an operating room as you're monitoring a patient. Not only is it time-consuming and tedious and error-prone, but it is difficult to document and difficult to perform the measurement when other critical things are happening. So the electronic devices can potentially do a better job. They can be more vigilant, they can have alarms, they can potentially be more accurate, and then we can use the information from one device and feed that into another system. So if you're just taking a blood pressure manually, let's say a nurse or someone else is taking the blood pressure manually, they may have to check with someone to see if their pressure is too high or too low. With electronic measurement, we can have an alarm, and that alarm can then be transmitted potentially not only to a nursing station, or just it could go to someone's smartphone or pager. So electronics are facilitating monitoring. They allow us to automate processes. They potentially allow for repeatability, and then they allow for acquisition of information more regularly and potentially more vigilance. So everything is changing along the same lines, and there are both benefits as well as shortcomings of integrating and networking and technologies. The examples I gave have been really examples of kind of basic technologies that have moved from old technology to more sophisticated or more automated technology. But there are also many things that we simply couldn't do once upon a time, and that the innovations in medical technology have to be based upon, the innovations in medical devices have to be based upon modernization of technology or more technology, microprocessor-based technology. So when I started my work in anesthesia many years ago, my training, the anesthesia machine was a pneumatic system. It had pipes and compressed gases and fluids and so forth. And now anesthesia machines are microprocessor controlled with multiple microprocessors, and they are also more capable. They can deliver breaths that are more carefully controlled. They can be used on sicker patients that have lung disease, little babies, and many other benefits of having advanced technology. So we have greater capabilities along with somewhat potentially more complexity due to the electronics. Potentially, not always. Sometimes they're simpler.